I am frustrated, as everybody in the state is, including the legislators, including people, the citizens out there, at the pace of the vaccination. We had our plan developed months ago. It was and is ready. The vaccine, the good news is that we have a vaccine to distribute. That is because of Herculean efforts made by the Trump administration that we're actually talking about distributing a vaccination, which usually takes 4 or 5 years, and we have 2 that are available now and 1 on the way. We have Pfizer's here now and Moderna. That's the one that's in the nursing homes and long-term care, and the others in the hospitals have been distributed out to the large and small hospitals. That's the Pfizer vaccine. That's the one that must be kept cold, very cold, so there are limitations on where it can go and how long it can stay without being in that deep freeze. But we are frustrated, and we are determined to eliminate the bottlenecks that are slowing this down. The good news is in South Carolina, we took a different approach from what they took in most states. We are much better off in South Carolina than they are in other states. In other states, they are cutting their budgets. In other states, they are taking services away from the people. We did not do that. We had our continuing resolution, we watched the money, and as a result, we actually have a small surplus that we will be able to distribute in the budget that you'll hear about later this week for the next fiscal year. That's because we were smart, we were careful with the money. But also what we did not do, which a lot of other states did, was they closed businesses unnecessarily. They went too far. They were not smart about it. We did just the opposite. We were careful. We issued no order closing non-essential businesses. Now, I've read in the press a number of times on such and such a date the governor closed non-essential businesses. That is not true. That is an erroneous statement. We never used that word. What we did was we put limitations or closed for as short a period as we could on those businesses that we knew through the science and experience had the most opportunity for the spread of the virus. That included barbershops, beauty parlors, retail stores, other things that you're familiar with. We had a list of about 30 different kinds of stores, kinds of businesses, activities, and turned that over, as you know, to the Department of Commerce to make clear. But we did not close businesses, non-essential or otherwise, like they did in other states. And as a result, our people are working. As a result, we have one of the lowest unemployment rates in the country. But we got to get back to work. We've got to get the children into the classrooms, which is what we were talking about earlier this morning, and we got to get the parents back to work. That is our goal. Now, we have to have a vaccination procedure to do that. So to go to that point, we are frustrated. But I asked last week, as you remember, I asked DHEC make public a list on the website, which they have done, of how many doses of the vaccine have come in and where they've gone. As you know, so far, except for the Moderna that has gone to the nursing homes and long-term care facilities and are being injected by CVS and Walgreens, that's one set. That's the vaccine does not need to be kept so deeply refrigerated. But the other has gone to the hospitals, large and smaller hospitals, and you have a list, and you will be continuing every day. You'll get an update on how many doses have gone in and how many have been used. But they're not being done quickly enough. So after the DHEC published that list of information, we had a meeting, we had a number of meetings, had a number of telephone conferences with hospital executives, with DHEC personnel, as well as others in the community, and we determined that we've got to move this more quickly. So what I asked DHEC to do yesterday was establish a deadline, and they are communicating that right now as we speak to the hospital executives. By January the 15th, if you are in group 1A, that's the first group, if you have not either gotten your vaccination or made an appointment to get it sometime shortly after that, then you're going to have to go to the back of the line. That is January the 15th. That's a hard deadline. If you have not gotten your, if you're in 1A, and we can read and see what 1A is, that's all the hospital workers, a lot of other listed there. If you have not gotten your vaccination, or if you've not made an appointment to get it, and those are typically made in the hospitals right now, and in the next few days or perhaps a week or so, maybe a little longer, we'll see. After that, then you go to the back of the line. It's like boarding an airplane. When they call your rows, if you don't get on the plane, you go to the back of the line. You get in with everybody else. That's what we're going to do, and we're going to take similar steps as we go forward. If we need to move that deadline up, if we're able to move the next group in early, then we're going to do that. But that is the deadline for all those people in 1A. And 1A has been clarified, is being clarified right now by DHEC with all the hospital executives to explain exactly what 1A is. Essentially, those in the hospitals, there was apparently there's always confusion in these things. You have to be dealing just with COVID, or can any hospital work? Well, it's any hospital work. Anyone in there dealing with COVID people or people that are at risk of dying or mortality for a variety of reasons. It's a very broad category, and we made that clear just as late as this morning. So we expect to see some progress. If we don't see some progress, then we will cause some progress. We'll issue the orders and make the directives necessary to see to it that the people out there, many of whom are ready and willing to get the vaccination, can get that vaccination without undue delay. So our state is open for business. We know what we're doing. We have managed this well. We have outpaced the other states. Other states have imposed draconian limitations. You've read about them. They having curfews and closing businesses left and right, and it has not done them a bit of good. They're in as bad a shape or worse shape than the rest of us. So those things are unnecessary. South Carolina has taken a smart, deliberate path based on Accelerate SC advice, based on information from all sources, from medical, from epidemiologists, and everyone in between, and we are going to get through this. We have the vaccine. The good news is we have the vaccine. The bad news is it's not getting out fast enough to the people, but we're going to fix that because we have found what we believe are the bottlenecks, and we're going to make it work. Are there any questions? Chip?
So what do you see as the primary problem? The hospitals, or where's the bottleneck?
There's some confusion over who was eligible to get the vaccine in the hospital. All the shots are going on, except those with the nursing homes, so far going on in the hospitals. There may be some others. There's some confusion about who in the hospital was eligible for it, but also a lot of the people in that category, a lot of even the hospital workers have not signed up, have not gotten the shot. Now there's some people that don't want to take the vaccine. That's okay. If they don't, we're not going to make anybody take it. But if you want to take this vaccine, then you're going to have to sign up and go get that shot, or either get on to have an appointment, and you got to have all that set up by January 15th.
So does that mean that phase 1 essentially starts January 16th, or is there some?
Well, I think we'll have to, good question, Sean, we'll have to see how many appointments are made, how many shots, how many vaccines, how many shots are given, how many appointments are made by January the 15th. If we are through, if 1A, if that is exhausted before then we'll start on the next group. But my plan is as soon as we have some clarity on how fast this is moving, is to allow those people in the next group to go on and make their appointments to get their shots. But by that time, they'll be able to go to we have probably 1,000 medical places, the doc in the box, they call them, all over the state, and they are being authorized as providers right now. In order to give the shot, it's not just a matter of going and getting the shot and leaving. It's not like that, because there has to be a record made of when the shot was given, because when you go back for your second dose, you got to get the dose of the same medicine that you got the first time. Also, they want you to wait 15 minutes. A lot of people that get various kinds of shots, flu shots, or allergy shots, you have to wait in the doctor's office 15 minutes before you leave. Well, you can't just run in and get this Pfizer shot and walk out. You have to wait. So the hospitals don't want to have too many people in one room at one time. So we want give them a shot, let them go sit in their car, keep the line moving, move the line as fast as we can. But to answer your question, just as soon as we see how fast this is going, then we'll move the next group up in there to get.
Can you expand on that? What exactly do you mean? Are they not going to be able to get into the next phase, or can you elaborate?
Say it again.
You say back of the line. You're going to have to go back of the line.
Back of the line, they'll have to go get in with whatever the next group is, just like getting on an airplane. Rows 1 through 12. If you show up and 1 through 12 is already boarded and they're on 13 through 25, if you're in 1 through 12, you can get in that group, but you can't. Your time to go in early is gone.
So 1A would then have to be in 1B if they miss.
That's right, and it go on down.
Governor, what if people in 1A aren't contacted? I have home health nurses and doctors who work home health who say the hospitals haven't contacted them, DHEC hasn't contacted them to get the shot. What if they don't get called? Do they still go to the back of the line in the next group?
They need to contact the hospital. I'm telling everybody right now, this is the plan. This is the way it's going to work. If you want to get that shot, you can go and there'll be new guidance issued as exactly what 1A is. I think it'll be coming out today. But you need to see if you're in that category, and if you are, and it's a very broad category, you need to call that hospital or contact DHEC. Don't wait for a letter in the mail.
DHEC said not to contact hospitals. They said that just a couple of days ago. So they called, someone's called DHEC, and DHEC doesn't tell them where to get the shot, and the shots are in hospitals. Are you really going to tell DHEC they need to be answering these people's calls?
They either answer the call, but the easier way is just put it on the website, because most everybody has access to the website. And we can see to it that that information is clear and is up to date, so that the average citizen who's in a hurry and got a lot of other things going on in their lives can understand what to do. That's part of the problem with some of these things is it's written in jargon and words that are foreign to most people, and we get lost looking at it. But those are the kind of things, those are the kind of small bottlenecks that add up to big problems that we are resolving right now. And I need to say, in my conversations with not only with the great people at DHEC, but also the hospital executives and others, we have a great group of people that are willing to work. But the key is communication, collaboration, and cooperation, and making it known to everybody when and where to go to get these shots. But everybody can look on the list. I know you've seen it. They have the hospitals on there, all of them that have gotten the doses. Call them up. Go to their website. Make some sort of contact, because the vaccines are there and they're going to keep on coming there. The hospitals they get what they ask for, and then they get more as time goes on. And the federal government we believe is going to be punctual and on time in sending in the follow-up doses.
Have these hospitals, there are some school systems that are still virtual right now. That state is virtual because of the case numbers. Some say that there's so many staff members out on quarantine they can't run the schools, and they're waiting on the vaccine too. Any words to our school leaders who are virtual right now because of case numbers?
My belief is that where there is a will, there is a way. There are schools that have been open the whole time for face-to-face instruction. Where there's a will, there is a way. The CARES Act has sent over $400 million to the schools. There's more available. We have offered and promised personal protective equipment from the beginning of this to schools, nursing homes, anyone else who opened it. The private schools are, I believe, virtually, and independent and Christian schools are all face-to-face 5 days a week, I believe. There are a number of districts that have been 5 days a week face-to-face. I see no reason why, with some imagination and a little bit of work, a little bit of effort, that the schools cannot open 5 days face-to-face. There may be some exceptional circumstances where it's not possible, but that should be the rule, not the exception, and it should be up to the parents. If 75% of the parents want their children to be in school and 25 want them to be virtual, then the school's not going to be crowded. There'll be plenty of room for distancing and those kind of things. And as far as the protective equipment, the glass partitions or whatever, that we have that stored. The Emergency Management Division got a place, got all that equipment ready for anybody. We've got to get these children face to face into the schools because it educates them for the future that's coming with jobs that we have never seen before, kinds of work, and it also allows their parents to go to work. That's why we were doing what we're doing this morning. Part of that is aimed directly at that need. The parents need their children to be in school so the parents can go to work. If that is one reason, because of our lack of our decision not to close down all the businesses, that we have jobs that are open for people. They can go to work. That was a good decision. That was a smart decision. And we're making more good, smart decisions right now. The other states, I don't know what they're going to do. They have budget deficits. I think Georgia just had to take $1 billion back out of their 4K program. We're not going to do that here. We are expanding. We're moving forward. We're being careful. We're being smart, and it's paying off for the people of South Carolina. Now, the good news is, again, we've got the vaccine. We've got it. Now we just have to get it into the people's arms. That's the best place for that vaccine to be. Shona?
Lawmakers have asked you to expand eligibility, basically do away with VHAC rules. Do you think that could be the next step, or do you think this will take care of that?
We just did some of that today.
Okay, in terms of, but I mean, in terms of collapsing the thing,
In
terms of mixing up things, say one thing will be, one thing will be.
well, it does get confusing, but we are clarifying that as you will hear after DHEC is reporting or having their conversations with the CEOs. They started at 11 o'clock, I think. We met prior to that. We talked prior to that. We had a final meeting yesterday afternoon at some length, and I think that those categories are going to be clarified and broadened. And if there's something else needs to be done, then I'll do it. We've got this, I have the authority under the emergency powers to change those things. I can't change a law, but I can change a rule, and we can do whatever is necessary to be sure that this vaccine gets to the people. Now, there's, again, someone asked, you can't just run in, get a shot, and run out. Also, all that has to be registered in a big computer. It's a federal computer called VAMS. For the nursing homes and long-term care, they have another computer. It's called Tiberius. I don't know where it is, but it must be huge because it gets all the information from all over the country about where the vaccine is going. You can't just walk in and understand how to operate, to enter that system. It takes some training. That's one of the stopgaps, one of the things that's slowing us down. That training is available at DHEC. The hospitals have gotten that training. Others are going to have to get the training before they can give the vaccine independently. So this is not just like getting a shot and going on about your business. It's more complicated than that. But the point is, it is not moving fast enough for the people of our state who have endured much in this virus and who have worked through it better and stronger than other states. So we're going to be sure that South Carolina is our economic health and our educational health and our physical health are all tops, because when the pandemic hit, we were on the way up economically. Our prosperity was rising. We took a dip, leveled off. Other states went into the basement. We leveled off. We never closed. And we're going to see that our people get this vaccine. Everyone who wants it.
Governor, in North Carolina tomorrow, there's a drive-through for residents 75 and older to drive up and get that vaccine. Do you want things like that to start happening very often?
Things like that will need to start happening soon. That's the direction in which we're going. But again, you have to understand there are limitations. You can't just drive through and then drive away. But we are going to see that we move as quickly as possible, much faster than we've been moving. And the good news is the hospitals all agree, the providers are eager to participate. It's taking longer than we wanted, but we're speeding it up right now today.
As far as your conversations with hospital executives, have they been willing to abide by that January 15th deadline? Have they been easy or difficult to work with throughout this?
No, they've been wonderful to work with, and DHEC is meeting this morning to discuss that deadline and possibly others with them.
As far as DHEC, there have been efforts. We know that President Keeler, for example, I think we mentioned this last year, pre-filed a bill to split up the environmental side and the health side of DHEC. Where do you stand on that? Do you believe that the agency should be split, or do you think it's fine the way it's working now?
I think it probably should be split, but that's going to, because it's a huge organization, it would logically fall into two parts, but that's going to be the subject of a vigorous debate and analysis. And what we've learned in this episode, I think, will be instructive in deciding what to do, how to make DHEC function better, whether as one agency, two, or perhaps some different fashion. But we have to, it takes a crisis, it takes something like this where you really put pressure on the system to fully understand where the weak points in that system are. And we're learning some things now that will benefit us in the future.
Governor, besides the deadline and clarification of some language in the plan, is there any other red tape that you or lawmakers could cut to kind of help speed up this process of vaccination?
Any that we see that I can cut, we will cut. Shauna?
How will the vaccination effort play into your decisions to open the remaining restrictions, whether that's the 11 o'clock bar curfew or,
The 250 limit, and the more people that get the vaccination, then the better off we are. But I have no intention of imposing more restrictions. We've taken off everything except those that you mentioned, unlike other states that are struggling financially because they're killing jobs. When you close down a business, that business, you can't open the door 3 or 4 months later and give them some money and expect them to pop back. It doesn't work that way. So we didn't do it that way. But we hope that this vaccination effort will have an enormous impact. But it is a growing with the other providers that are signing on, the drugstores, the pharmacies, all the various other types of clinics and offices. It ought to work much faster than it has been. But I will do whatever is necessary to keep our team together and have them working at maximum efficiency and speed to get that vaccine out to the people.
Governor, when it comes to manpower, some hospitals have said, at least for them, that is a bottleneck, is using the state National Guard at all on the table in addressing this.
Well, the National Guard has been involved, and they're also involved, as you know, in preparing to set up hospital beds if necessary. If the hospitals get full, and you take some people out and put them, those that are not in intensive care, to open up more rooms. Our National Guard has been involved from the very beginning, and they're involved in this distribution process. But we have plenty of offices, businesses, the drug stores, the pharmacies, the doctor's offices, as well as all the hospitals that are available. National Guard can participate in that as well. We have the outlets. We've got to get the people in there. And that's why we're putting this deadline. If you want the vaccine and you're in this first group, which is a big group, then you need to go on and get your shot, make an appointment, go, because most of it is by appointment because of the complications I mentioned, the paperwork that's necessary. Go ahead, get that shot, or make an appointment for after January the 15th if you can't get there before. But if you don't do that, then you move on back in the line, that your priority will be up. So we want to urge people to let's get moving.
I have a off-topic vaccine question. Tomorrow, Congress will start debating debating the Electoral college certification. We've seen at least 4 House Republicans who say they're going to object to that. Do you agree with their plans to object to that certification, or do you think that Congress should vote to certify the Electoral college?
I think that there are many issues that were raised in this campaign. Some observers say there are more allegations and issues raised in this presidential campaign than any other. That they know there have been some disputed elections prior. But I think if is anyone who has a question that they won't answer, a legitimate legal question, something that there's a forum for, I think they should take advantage of it. I think that we need to have confidence in the election, and people, if there's a way for them to get their questions answered, then they ought to get them answered. If there's not, then there's not.
So should it be objective? I mean, do you support their position to object?
I think there are a lot of questions raised. I've myself never seen so many questions raised in so many states by so many different people. Never seen that before, although I have read about some disputed elections. But again, if anyone has a question, there is a procedure, and they're following that. The senators and the congressmen, and several of them from South Carolina, the congressmen, they're following those procedures.
Thank you, guys.